Everybody sitting comfortably, then we'll begin. I mean, as I've come to understand about academia, nothing can be hurried, so I guess people will stroll in. My name is Victor Adebowale. I am, amongst many things, Chief Executive of Turning Point and a board member of NHS England. And a member of the House of Lords, but don't hold that against me. I've been asked to chair this session, and what we're going to do, if that's okay with you, is we're going to have all three. I'm going to say a couple of words about the issue from my perspective to start with, and then we're going to have Dr. Rosalind Willis from the University of Southampton, followed swiftly by Michael Larkin from the University of Birmingham, and finally Professor Fiona Irvine from University of Birmingham. We're going to have all three presentations, so I'll force you to pay attention. And then we'll have some questions to all three presenters. Is that okay? And a bit of a chat. We will finish at 1 o'clock because I've got a fast car arriving and I'm off at 10 past. Is that all right? Yep. Is that what you expected? Okay, good. So, oddly enough, in the next few weeks, there's going to be a piece of research put out into the NHS, actually not necessarily about the experience of different ethnic groups of health and social care, in this case social care, but actually about the people that the NHS and social care services employ. And the clue is in the title of this report, watch out for it. The title of the report is The Snowy White Peak. The Snowy White Peak. That's the title of the report. It kind of said it all. Yeah, I keep forgetting that I'm amongst academics. The word has to be spelled out. Peaks as in mountain. So that's going to be, but this, so therein lies a clue actually, in my view. The research you're going to hear about is going to cover the reasons for ethnic group differences in satisfaction with social care. An area of huge interest to me as I chaired the Delivering Race Equality Programme for the Department of Health, a painful experience that I'll never repeat again. And then we're going to hear about people with learning disabilities from black and minority groups, something of a misnomer in parts of London anyway. And then we're going to hear about factors that contribute to satisfaction with social care for physical disabilities amongst people from Chinese backgrounds. We all know there's still inequalities faced by people from BME communities. There have been improvements, but I would argue that they're still at the sharp end of the inverse care law. That law that states those people who need the health and social care the most get it the least. I'm very much involved in the delivery of the Comparative STEAM programme, which of course I'm familiar to some, if not all of you, and there are at least 1 million disabled people from black and minority ethnic backgrounds in the UK, and this number is growing. And 44% of BME disabled people live in household poverty, compared with 32% of all disabled people, 70% of the population as a whole. And we know that people from black and minority ethnic groups living in the UK are more likely to be diagnosed with mental health problems and be admitted to hospital and disengaged from mainstream services. So, it's not a great story. So I'm hoping that our discussion might shed as much light as heat on the subject. And without further ado, can I hand over to the very patient Dr. Rosalind Willis from the University of Southampton.
Thank you. Hello everyone, I'm Ros Willis from the University of Southampton. I'm a lecturer in gerontology at the Centre for Research on Ageing. I'm also presenting on behalf of my co-authors and co-researchers, Maria Ivandrou, Pathik Pathak and Priya Kambaita, who couldn't be here today. So to start with the acknowledgements, obviously the research I'm going to present could not have been done without the kind participation of all of the people who were involved, so I'd like to thank them, and also to thank the funders and give the usual disclaimer. So I'm going to give you a brief background to our research project, not spend too much time on that because I know that the people who are coming after me are talking about a similar topic. I'll talk a little bit about the methodology and then into the findings, which is the main reason why we're all here today. and I'm going to talk about similarities and differences in reasons for satisfaction with social care among two different ethnic groups, the White British and South Asian groups. And then I'll talk about the key themes that we found in our research and end with some recommendations. So our project title was Acceptability of and Satisfaction with Social Care Services Among South Asian Groups, a case study of Hampshire. Why South Asian groups in particular? Well, we decided that this was a very good group to examine in the Hampshire context. In Southampton and Portsmouth, South Asian people, so Asian British people, form the second largest ethnic group after the White British. And also because a lot of the stereotypes and assumptions around minority ethnic groups preferring to look after their own tend to be focused around people from South Asian backgrounds. So we thought this was an excellent opportunity to explore these issues. Our research question was actually came from the School for Social Care Research. They wanted people to research why people from minority ethnic groups tended to report lower satisfaction with social care compared with the white population. And I know that the other people who are presenting after me were funded under the same stream, so there's several of us looking at it from different angles. So we had a 2-year project which finished in January, so I'm able to now present to you our findings. So, brief bit of background, the national surveys on satisfaction have shown consistently that people from Black and Black British and Asian British groups have had lower levels of satisfaction compared with the white group. That's not the White British group, it's the white group. So all the white people who responded were put into the same category. The question on the surveys was, overall, how satisfied or dissatisfied are you with the care and support services you receive? People responded on a 7-point Likert scale, extremely satisfied to extremely dissatisfied. But of course, we don't know why people answered the way they did because there wasn't an opportunity for elaboration, hence the need for our projects. So I just wanted to briefly mention something about the satisfaction process, because we're actually talking about a very complex process that goes on here. It's not just a straightforward relationship between an objective experience you have and being happy with the outcome. So satisfaction is a state of contentedness, but you come to this state after making a judgment about whether you are pleased or not with the service. So service satisfaction is obviously influenced by your experience with the service, and the day-to-day interactions between you and the care staff, for example, how easy it was to access the care in the first place. But also it's influenced by your expectations. So what did you think was going to happen in the first place? And these expectations can be overly optimistic and overly pessimistic, for example. And you could have unformed expectations. So if you have had no experience with social care services in the past, you might have no understanding of what the social services can offer. You don't have any expectations. Perhaps you think they're going to offer everything in the world, therefore you will be disappointed when you discover that they're not able to offer everything. And it's possible that there are things like normative expectations about the acceptability of social care services, which may differ across different ethnic groups. And then we have the evaluation process. So this is where the subjectivity comes in. Two people may receive exactly the same objective experience, but evaluate their satisfaction differently. This all comes from social psychology literature. And one of the theories that's important here is equity theory. You make a judgment about whether you think you've been treated fairly compared with other people. So all of this leads to your decision about whether you're satisfied in the end. So it's a very complex process. Before we started, we did a literature review and we came up with some potential reasons why there may be ethnic group differences in satisfaction. Firstly, of course, the minority ethnic groups may be receiving objectively less good care than the white British population, which could be due to discrimination or racism, and equity theory comes in here, or possibly that some of the specific aspects to do with being from a linguistic or religious minority may be at play. Maybe your needs in those areas are not being met. The people from minority ethnic groups, particularly who have migrated to this country, may not have had any experience with social care before, so they may have unformed expectations of the service or very idealistic, over-optimistic expectations which may not be met. It could be that services are viewed less favourably than among the white British population to do with normative expectations about whether services are appropriate or acceptable. And of course, it could be that there was a methodological problem with the survey in the first place, and that could be the reason for the differences. Okay, so what did we do? So we did in-depth interviews with 121 people. We interviewed service users, informal carers, and service providers. We decided to look at both South Asian and white British groups who have experience with services. And that was because if we only focused on the South Asian groups, we argued that any explanations we got from that, we couldn't say whether it was specifically to do with their culture or their religion or their ethnicity or whatever, unless we had a control group, a comparison group. So we wanted to be able to see, well, what are the things that are shared across service users from both of these two broad ethnic groups, and what are the things that are specific? So that's why we've got the two ethnic groups represented there. There were two of us who carried out the interviews, myself, I'm white Irish, and my colleague Priya, who is British Indian. And she has language skills, so she was able to interview people in Hindi and Gujarati. I, of course, was only able to interview people in English. Not surprisingly, not many of the Asian people spoke Irish, so I couldn't interview them. We had a wide range of recruitment strategies, including going to temples and churches, community groups, and also sending letters out via the local authorities directly to particular service users and carers. And we did thematic analysis for our data analysis. So what did we find? Well, there were quite a lot of similarities and differences among the white British and South Asian groups. Looking at the similarities first, one of the interesting things we found towards the end of the interviews, after we discussed people's experiences, we actually asked them the question from the survey again, the satisfaction rating question. And the majority of people, so that's 71 out of the 82, said that they were satisfied with the services they had received. But very few of them were completely happy or completely unhappy with the services. In some cases, they only became satisfied with their care after they had made a complaint about something problematic and that had been resolved. And in other cases, when we were asking people this question, they would rationalise their decision. They would say, well, apart from this, I'm satisfied. So this suggests that we do need to look beyond the simple question about what people tick, that it doesn't actually tell you everything about the whole experience. And that even if somebody on the satisfaction rating says that they're satisfied, that doesn't mean there isn't a problematic aspect with the service. There were some very good news stories. Lots of people said the staff really cared, and they've very much appreciated staff having a caring manner, being empathetic and charming. They used the word angels to describe some of the care staff. And continuity of care was a very important aspect, shared across our two broad ethnic groups. Continuity of social worker and continuity of domiciliary care staff as well was very important. This is particularly important for the confidence of the client, especially if they feel that they have the same person coming back day after day. They don't have to start again and explain what needs doing. One of my participants told me that her father didn't want to actually ask the care staff to bathe him, even though that was in the care plan. He didn't have the confidence to actually say that, and he felt embarrassed. And if the domiciliary carer hadn't read the care plan in advance, they wouldn't know that that was what they were supposed to do. So he was actually saying, can you make my breakfast? Rather than, can you help me to get washed? Because there wasn't the continuity and they didn't have the time to read the care plan. It was particularly important among people who had culturally specific needs as well. So one of our South Asian carers said that his mother needed to be showered twice a day, morning and evening. And the way he described this to me was, well, maybe in white British culture, assuming I was white British here, you don't wash twice a day, but we, in Sikh culture, we do. The care staff don't realise that, and if they haven't read the care plan, then they try and fight me and say, well, why does she need to be washed twice a day? She's already had her shower. So obviously, reading the care plan in advance is very, very important in these sorts of cases. Okay, in terms of the differences, there were several differences that were to do with being from a culturally or linguistic minority. So, for example, experiences of discrimination that people associated with racism, unformed expectations due to not having any experience with social care at all, and language was very important. So several of our participants didn't speak English at all, or had only a very basic broken level of English. And this meant that there was a practical difficulty, not only in using services on a day-to-day basis, but also learning about services in the first place. And this impacts on their understanding of the social care system. So language matching of care staff to clients was the ideal solution, but ethnic matching was not considered important. Most of the South Asian participants found that the way to meet these needs was to use culturally specific services. However, other participants told us that the culturally specific services they had been using had been closed down and weren't actually available anymore. In terms of the white British groups, we found that more white British people than South Asian people tended to talk to us about staff abilities and staff interpersonal skills. Staff were described as being good listeners and providing choices, ensuring clients were not disabled by their care, and being knowledgeable. But there were some problematic aspects, like staff speaking in a patronising way, not being able to do household tasks properly, and asking the wrong questions in assessment. I'm not really sure why the white British people would tend to talk about these issues and the South Asian people didn't. That's something I would welcome your thoughts on. Okay, so this is our key theme, understanding the system. So in our analysis, we explored the ways that participants' expectations influence the rest of their narrative, and this process resulted in an overarching theme that we called understanding the social care system. Our participants could be distinguished from one another by whether or not they had a good understanding of the social care system, including how they were organised, funded and operated. Participants with a good understanding tended to discuss the more structural and organisational aspects of the social care system, and were able to lay blame for problems on the system and not on the individual care staff. In contrast, the participants who did not understand the social care system were often frustrated because they could not identify what the cause of their problem with care was. They didn't know why their day centre had closed, or why they were not entitled to more hours of domiciliary care than they were receiving. These participants did not discuss the structural and organisational aspects, and instead focused more on the process of care or their unmet need. Now, there were white British and South Asian participants in both of these groups, but there were more white British in the clear understanding group and more South Asian in the unclear group. And we think that the poor understanding of the social care system limits people's ability to make the best of it, and the poor understanding is exacerbated among the South Asian group due to unformed expectations, language barriers, and migration from countries without social care systems. So here's an example of one of our quotes. So here's somebody with a very good understanding, and this is our theme that we call blame the system, not the staff. I need to speed up, so I'm not going to read it out. The next quote is from somebody with a poor understanding. This is a South Asian participant. She's very dissatisfied. She doesn't know why her service has been taken away from her. And she's very frustrated, and she has an unmet need now. She can't go anywhere on her own because her day centre was shut down. She doesn't know why. Okay, so then we had a key theme called working within the system, and this is a model, those of you who use NVivo will recognise the graphics. So this shows how understanding within the system and working within the system fit together. So this side, we've got two nodes related to asking for help. So the two nodes represent two sides of the same coin. Some service users and carers understand how to work within the system or asking for things in the right way. Those who have not yet reached this point are dissatisfied because their experience is that no help is offered if you don't ask. The participants who ask for things in the right way have a good understanding of the system, but those with a poor understanding do not know the magic words, that's a quote, to open the door to the services. The other side of the coin is that services wait for carers or service users to tell them that they need help, and therefore no help is offered if you don't ask. Unfortunately, if people do not know that they have to ask for help, or even what services to ask for, this leaves them with an unmet need. To the other side of the model, here, we've got two nodes relating to the way informal carers view their interactions with social care staff. So some informal carers felt that they had adapted to work together with care staff in order to ensure that their cared for person's needs were met. They shared the load between them and they were satisfied with the care. Only participants with a good understanding of the social care system could be found within this theme. On the other hand, some informal carers felt the services were putting too much load on them, and they said services expect too much of informal carers. So, in summary, the participants with a good understanding of the social care system were able to find ways to work within its restrictions, and so they felt supported and in control and hence satisfied. And the participants with less of an understanding of the inner workings of the system felt burdened and abandoned and hence dissatisfied. Now, I've got several quotes for those. The handouts should have been sent around, so you can see the handouts if you want. But hopefully you'll agree that these support the themes we had. So that's asking for help, that's working together or alone. Okay. So to summarise, so we argue that satisfaction partly derives from service users and informal carers adapting to work within the social care system. In our study, the people who had done so tended to be insiders, meaning they may have worked with social services before or had a very long interaction with social care services before, thus becoming an expert carer or an expert service user. And both of these groups did include white British and South Asian participants. Many of the things people were dissatisfied with involved the funding cuts, the nature of the purchaser-provider split. Specifically, if people didn't understand how the funding was allocated, or they didn't understand the pressures on domiciliary carers, they were less likely to excuse the staff. So we didn't have the blame the system, not the staff, for these people. So then we say, if people don't have a good understanding of the social care system, they will be dissatisfied, but also frustrated because they cannot explain the reasons for their problems. And our recommendations. So, despite a few people being entirely happy or entirely unhappy with their services, there was a bias towards positive satisfaction ratings, which has been shown in a lot of the work on measuring satisfaction before. So we argue that the user satisfaction surveys ought to be supplemented with more opportunity for service users to convey their whole experience, whether this be with providing a box for people to write that in, or actually interviews with people to help them fill these in. Our other recommendation is the need to improve communication at every stage so that people's expectations about services are realistic and they understand the reasons when services have to say no. So you can't have this service, or you've got 15 minutes once a day, you don't have 15 minutes twice a day, or whatever it has to be. This communication can be done at outreach stage, at assessment stage. Obviously language needs need to be met at every stage in the system. But also people wanted more follow-up calls, more visits, and they really did not like being told that they'd been dropped from a social worker's caseload, for example. They felt very abandoned by that. And they wanted to have a named person that they could call throughout the duration of their interaction with social care so that there would be consistency. And we think these issues are particularly problematic for the South Asian group in our study because they had additional barriers to accessing this knowledge due to language and due to, for many of them, being first-generation migrants. Those are my references. Those are my contact details. And just a plug, we are hosting the British Society of Gerontology conference in September, so please come and see us. Thank you.
Thank you very much. Mr. Larkin, the floor is yours.
Thanks. That's good. Thank you. So my name is Michael Larkin. I work at the University of Birmingham. I'm a qualitative researcher and a psychologist. And most of my work is in mental health rather than learning disability. So this has been a bit of a learning experience. I've been lucky. I've had Gemma Unwin as a research fellow on the project who has lots of expertise in the area of learning disability. We've had a really good research team and steering group who've also brought lots of expertise in those areas. And I'll be mentioning the contributions of Primrose Naomi Yarrow and Malvika Iyer as we go along. Our project came from the same commissioned brief, I think, which was about understanding a specific instance of why people from black and ethnic minority groups reported lower levels of satisfaction in experience surveys. And the call was particularly for qualitative, in-depth work. And John Rose and myself had worked with Kuljit here, who was one of our PhD students at Birmingham, just prior to this call coming out. And Kuljit had done some work looking at the experiences of families of people with learning disability in relation to social care services. And what she found was really consistent with what you've just described. And one particularly interesting thing was the way in which, in Kuljit's work, you could see the level to which social capital or access to social resources shaped people's ability to get what they wanted from services. So we had some families who participated in Kuljit's work who were from Sikh families who had been relatively successful in terms of their socio-economic status, and they got high levels of education in the family, and they had got an understanding of what the person's difficulties were, which matched quite well with what services' understandings of what the person with difficulties were. And they'd got access to the kind of social resources you need in order to say the magic words and so on. And that compared quite dramatically with some of the Pakistani Muslim families in the study who lived in areas of considerable social deprivation in the West Midlands, who didn't have the kind of social resources, where the kind of the key adults in the family, the ones who you would expect to be engaging with services on behalf of the person with learning disability, they didn't have even the language abilities to engage with services, never mind the kind of the magic words. So we were interested in what the service user perspective would be, and we decided that would be our focus. We've taken the view that we're understanding learning disabilities in terms of the impairment in intellectual functioning and impairment in adaptive social functioning, the combination of those two things, which is the British Psychological Society's definition. And we wanted to take the view that ethnic minority identities weren't just sort of demographic categories that people would slot neatly into. We wanted to think a little bit about what it might mean to claim a particular kind of identity for yourself. And so in this study, what we've tried to do is to treat people's sense of who they are and how they position themselves in culture and in relation to their geographical origin and their generational origin and the things that matter to them. We've tried to treat that as data rather than as a means of categorising our participants. And also I'll try to give a flavour of that in the talk today. That's probably the main thing I'll manage to get across. The aims which we set ourselves were that we would provide an analysis of service-related experiences of people from ethnic minorities with a learning disability. And then we provide some guidance on steps which could be taken by social care providers. And in order to do that, excuse me, I've got a bit of a sore throat this week. In order to do that, we said we'd engage with a cross-section of people from ethnic minorities in the West Midlands who have a learning disability. What we particularly wanted to do was to identify some reasonably coherent subgroups in our sample. So we knew that we'd have a modest sample size because we wanted qualitative data. Within that, we wanted to be able to sort of drop down a level and look at groups of people who shared something in common in terms of their backgrounds and what mattered to them. So we focused on the larger subgroups in terms of British South Asian and Black British communities in the West Midlands. We kept an open mind in terms of if other people came forward with other backgrounds, we were very happy to have them included, but those were the main groups we set out to engage with. And we wanted to find a way of engaging with them which would allow them to tell us their stories in an acceptable and sensitive way. And then we said what we'd do, we'd take all that to some kind of group event and think about what the outcomes of the project were. And I'll say a little bit about those outcomes as well. So the context of this is interesting. As has been said already, we know that minority ethnic groups are less likely to be accessing or satisfied with social care services. The data for people with learning disabilities is a bit different. So people with learning disabilities, there are odd peaks and troughs in there where they're represented separately in the adult social care survey data. And so we think some of that is to do with the kind of positive acquiescence that you can sometimes get if you don't collect survey data very carefully and very sensitively from people with learning disabilities, and some of it might be to do with who helps the person with learning disabilities fill the paperwork in, and the recent study reported by NatSen gives some indications of how that might shape the outcomes. And some of it's to do with some of the problems that we've seen already in the previous presentation in terms of what satisfaction means and whether that's a sufficiently kind of robust concept. And of course, we were doing this, it's worth emphasising that, we were doing this work at a time when there was intense economic pressure on services. So we're also aware that one of the things that's very important to people in terms of consistency and continuity of care would be being disrupted because of changes in the way that care was being provided. So one of the things that we did was we tried to come up with a data collection strategy and approach to the interviewing which was accessible for people with learning disabilities and gave them an opportunity to tell us about who they were, what was important to them, which was more than just filling in a demographic box. So we produced this thing called a culturegram based on something rather similar in the literature, but that have been designed with different intentions. It's just a kind of map, really, for talking about different aspects of people's cultural identities. And it worked really well, both as a way of identifying where culture was important to people and also where it wasn't. It wasn't always the most important thing in terms of people's experiences of service use, and I will come on to that. But it was a good way of facilitating that sort of conversation. And so one of the outcomes of the study has been that we've produced a set of talking tools that start with a slightly more open-ended version of this, which we hope social care providers will be able to use in order to have conversations with people about how they see themselves, what's important to them, and then what kind of support they want. We transcribed all our interviews verbatim, and we used a combination of thematic approaches to analyse them. So we started with the dozen or so richest interviews and did something quite close to IPA, but not the full way through. So an experiential focus, looking at what was important to people and keeping that absolutely central. And then we produced a template, and we applied that template to the rest of the data and adapted the template according to wherever new material arose. Hang on, behaving strangely. Our participants came from a range of organisations, some of which were culturally specific, most of which weren't. We have 29 interviews with 32 participants. They are people with mild to moderate learning disabilities based on the functional indicators in our little screening tool. They were interviewed by Gemma Unwin and Coulson Mughal. There were 3 participants whose data we excluded because of concerns about capacity or safeguarding. And we also decided to interview some social care providers in order to sort of get that perspective. And I won't discuss that in any detail here, but in output from the project you might sometimes see that we're comparing the 2 points of view. We think there are 5 really interesting areas of analysis in the data, and I'd like to focus on the one in green here. How's culture related to our participants' views of themselves and of the services they receive? And just to give a flavour really of what's in there, one thing that's clear is that our participants understand their cultural identities in complex ways. So they're not simply demographic categories, they're doing nuanced, complex things with their identities, as you'd expect. And in some cases you can see that there's an intensity of commitment to a particular cultural identity, and in others there's a multiplicity of identities being drawn upon. And just to give you a flavour of the beginning of that spectrum, I'll show some data extracts in a moment. What stands out though is that just asking about ethnic origin and religion doesn't capture people's cultural commitments at all. That people could be quite vague sometimes about their religious commitments, but then they might have really strong opinions about food. Food's particularly important for people. Or they might be ambivalent about religion, but there might be other cultural aspects that are really important to them. So we thought the culturegram idea worked really well as a means of getting to know what was important to people. So here's a couple of extracts from the same interview. They're only a few seconds apart actually, with Barry. Gemma asks Barry if he's treated fairly. He says, of course they do. She asks about whether they respect the fact that he's from a Jamaican culture. He says they don't mind. She sort of prompts him to say a bit more. He says, I don't think they mind anyway, and I say I'm black and I'm proud of it, and there you go. And they can't say nothing more than that, can they? And he sort of starts to talk a bit more about Christianity and how that's important to him, and that leads him on to music. And so a little bit further down, Gemma asks him to say a bit about listening to reggae music and Christian music, which is what he's been talking about. And there's an interesting sense of connection and importance, I think, in the language here. You know, that it's partly to do with where he's from. I was born in a reggae country, and there's this sense of warmth here. I think, you know, where he says, I mean, the big Bob Marley, there's a sense of sort of ownership and connection in that language. I think that it's clearly important to Barry and how he positions himself. Ooh. Sorry about that. Similar kind of range of things here. So Prakash is talking about being a member of a sort of second generation family, and one of the questions we asked was about religion. No, and then we asked about holidays and festivals. So you've got Diwali, Vaisakhi. Can you tell me about those? So their understanding of Diwali here isn't really entrenched in a religious position. It's about it's a point in the calendar, isn't it? It's an important celebration. I think that's what's interesting about it. So it's still important to Prakash, but it's not something that's connected to a spiritual commitment in this particular case. So Diwali is where they've got Diwali lights and where everyone's celebrating it in the middle of the road in Melton Road, Belgrave Road in Leicester, not just in Leicester, in Coventry as well. It's just like God, religion or something, that's all it is, I don't know. So it's the spiritual content isn't that important for this particular person, but the sense of this as an event in my annual calendar is just like New Year is. You can see similar kinds of range of commitments here. So Stephen's talking about going to church when he was younger, but not anymore. Tali's talking about generational differences in her family in terms of who speaks which languages. And there's a sense of Pakistani origin being important in this family, but also that as a younger member of the family, it's different for her. She hasn't been there, and the older members of the family who don't speak English are actively dying out, and so her kind of situation is changing. So we had that sense from the participants of this kind of dynamic range of identities and things that were important to them. And in that context, we were asking them about support and social care. And there were very few complaints about the cultural appropriatenesses of the services they received. And we have one anecdote, effectively, about that's a kind of a complaint about that. And I don't want to tell you the anecdote because it'll lodge in your mind and you'll think that's the thing. And in a sense, what I'd like to emphasise really is that, firstly, for the participants, it was the relationship with individual care workers that was really important to them, rather than a relationship with a service provider. Secondly, that for people with learning disabilities, it's very often families who are doing the buffering in terms of having to fight for services and experiencing frustration. So I think our participants are perhaps a bit protected from that. And thirdly, that our participants are, I think sometimes you can see them self-monitoring in the data. They're consciously aware of the fact that services are under threat, and they're being very careful to tell us positive things about the things that they like, and because the idea that this information won't get back to individual service providers is hard to hold in mind. And so I think there was a sense that, you know, we'll focus on what's positive. So that's what we've drawn upon. And I suppose the key material is about relationships and what it's like to work with particular people. One key aspect of that is being understood, and you can see that in the first quote here. Sometimes I do lose my temper and say, yeah, the staff's are crap here, they're not doing a good job. I start being nasty to them and everything. And then afterwards, when I'm calmed down, I come down and I say sorry to them and say I'm apologising. Well, they know how I am, and they know me well now, and that's why the staff are good here. So the sense of being understood. Also, being listened to was really important. I think it's because they understand you. When you knock the door, they'll listen to you, they'll have a laugh with you. Being companionable was also important. And being able to provide practical, competent, reliable help was important. So they help you talk about it, they help you if you want to talk. I mean, he's good, you know, he's a good support worker, he's done everything he can to support me. So these were all features of people's relationships. And so we were aware, as we were drawing on some of that data, that families' experiences were likely to differ from those of the service user. And that's also reflected a bit in the accounts from Primrose's interviews with service providers, who largely focus upon, if you like, flashpoints in their relationship with families. And it's not the service user directly, it's not the person with learning disabilities that they're seeing as the kind of the person that they're having conflict with. It's family members in their narratives. I've resisted the urge to show you extracts from that study as well because I'm trying to stick to time. So those are the sorts of things that we're starting to pull together. What we've been doing alongside sort of drawing out some of those more academic thematic analyses is also trying to provide some quite practical tools for service users and service providers. So what we've got a set of short videos. They're all like 3-4 minutes long, one around each of those themes. So what does it mean to provide good support? So what does culture mean to me? Who are the people in my life who are important to me? What are the activities that I would like to be involved in? Those kinds of things. And they're intended to provide to stimulate a bit of discussion, and with that we've developed what we're calling a set of tools for talking. So they're just quite straightforward materials that people will be able to print off in PDF form and use as the basis for discussion after watching one of the videos. And we hope that people will start with the culture one first, so to get a sense of where the person positions themselves in culture, and then work their way through some of the other activities in order to come to an understanding of what culturally appropriate service provision for this person might be like. So we've piloted those. We've had really useful input from service users and service providers at an event which we ran in November. So we're busy adapting those at the moment. They'll be online by the end of this month, we hope. They ought to be, because we're launching it at an event the 28th of April. If anyone would like to come, you can drop us a line. They look a bit like this. So this is one of the examples. So this is a rough draft, but this is from the things I do now and things I would like to do. So there's a video that goes with this, which shows, which we have built from a composite of our data. So it's people with learning disabilities talking about the things they currently do, the things they would aspire to do. And so there's a kind of a rough structure for the discussion, and then to go with that, there are these cards. So you can cut out the cards, you can move them around, you can pick out ones which reflect things which people are currently able to do, ones which reflect things which they would like to do, and you can start to think about perhaps what needs to happen in order to move one or two of the things which are aspirations at present towards reality. So there'll be 5 or 6 sets of those, and you can see here there's some pictures of those in action. So we road tested these with our steering group and also with some of our research participants who really gave us some excellent feedback, but also found them very engaging. So we had some very encouraging responses to those. So that's where we are. And that's how you can contact us if you'd like to contact us.
Very good. Okay, last but not least, we have Professor Fiona Irvine from the University of Birmingham.
Just find my presentation. Okay, well, thanks very much for having me along today to hear about our project, which is also funded from the same stream. So again, a qualitative study looking at people from minority. Can you hear me? No? No. Looking from people from minority ethnic groups. I'm here today with my colleagues, Dr. Martin Partridge and Dr. Echo Young, who are sitting there with me and may join in answering the questions afterwards. So we were looking specifically at people from Chinese backgrounds to hear about their experience of social care. Again, funded by the School of Social Care Research, and it was looking at the satisfaction of social care amongst people with physical impairments who were from Chinese backgrounds and resided in England. And similar to the other presenters, we come from the stance that we know that people from BME groups report lower levels of satisfaction with social care, and that these include things like lower levels of contact from formal services, even when people are known by the services, experiences of prejudicial symptoms, especially in relation to the role of informal carers, and a lack of awareness of the information that's and the services that are available to them. So the latest census survey tells us that people from Chinese backgrounds are the fastest growing minority group in England, but very little is known about their satisfaction with social care. In general, we know that they underutilise disability support in the UK and in other societies, and often this is explained by things like a lack of knowledge of the services, language difference, difficulty in locating quality interpreting services, and a reluctance to seek help outside of the family setting. So based on that, the aim of our study was to look at people's ideas about social care, their levels of satisfaction, and to identify areas that may be able to be improved. So we set out, again with a qualitative study, involving 3 elements: semi-structured interviews with individuals, focus group interviews with small groups, and finally a World Cafe conference. And we gained ethical approval from the Social Care Research and Ethics Committee. So we were looking for people from Chinese backgrounds who were aged between 18 and 64, and I say approximately because some people were not able to say exactly what their date of birth was, so we had a little bit of movement there. People who resided in England, had a physical impairment, and received social care. Now, we actually knew that this was going to be a hard task to actually recruit these people. The Chinese population is well dispersed around England. Often that's because people find themselves in the food trade, if you like, the restaurant trade, and therefore go to every corner of the country. Although there are some pockets of higher intensity areas in the major cities. So we knew that we were going to have a difficult task, so we went all out to try and recruit our respondents, and so did things like go to local authority social care teams, to Chinese community centres. We put out these flyers into Chinese supermarkets. We advertised in community care magazines. We put leaflets and posters everywhere that we thought might be appropriate. And we also used a snowballing technique as well, so we asked people to identify other people. And that was quite an intense process. There were points where we thought, we're never going to do this, but we made it in the end and recruited 26 participants, roughly as gender spread, equal gender spread, people who were speaking Cantonese, English and Mandarin, and some whose second language was Hakka. And as you can see from there, they originated from various different parts of the world, some UK born, but many were immigrants. Okay, and we started by doing face-to-face semi-structured interviews with individuals. We used Chinese-speaking interviewers and an English-speaking interviewer sitting there, and conducted the interviews between July and March 2013. We undertook the interviews in people's homes or in the community centres that they were linked to. We gave everybody who took part a £10 gift voucher and paid their travelling expenses as a bit of an incentive. And we carried out the interviews in the preferred language of the participants. There was 2 where we had to use an interpreter because we weren't able to match the language, but the rest were preferred language. So we ended up with 16 in Cantonese, 2 in Mandarin, and 8 in English. In some of the interviews, family members were present as well, and in that situation, they also contributed to the interview. And you'll see that in the data. So we then followed that on with focus group interviews. So every one of those members of the individual interviews were invited to come to focus groups. We held them 2 in London and 1 in Manchester. 14 participants chose to attend those. Most of those were women, interestingly. And they were taken in the Chinese community centres. And essentially what we did was present to them the initial themes that we'd identified from the data analysis of the qualitative interviews, and ask them then to comment on them, question whether they appeared to be representative of their position, and actually to expand as well. So we actually developed more data as a result of that. And then finally, we held a very successful World Cafe event in Birmingham, whereby we invited service users, carers, service providers and commissioners, fed back the research to those people, and again asked for comments and also to look at how that might have an impact on policy and on practice. That proved to be really successful and involved people linking up with each other and coming up with some good ideas. Okay, data analysis. All the conversations were audio recorded, fully transcribed in the language of the account and analysed in the language of the accounts as well. But we will present back English data extracts here, and we do that in the papers. And so we went through this process using NVivo, and you'll see the verbatim quotes now. So we came up with 4 key themes. Access to social care, quality of services, personalisation, and language and cultural sensitivity. It's interesting how much we all identify very similar issues. So in terms of access to social care, it was evident, really evident, that many people had real difficulty accessing social care services. They didn't know that they existed, and they didn't know how to access them. And so we ended up in situations, or people did, where they had reached a crisis point, really, before services were put into place. And for some people, that was being hospitalised. So it was quite extreme in terms of accessing the service. So there's a couple of quotes there for you. Just didn't know what they needed to be asking for, really. In terms of quality of services, we had two sides of the coin as well, if you like, a bit of a continuum. Attitudes of staff was very important to people. Whatever the cultural background of the staff, it was very important that they treated people with sensitivity. And there was some feeling that that wasn't always the case, that people were just doing their job, that they saw their clients just as a job to be done, and didn't treat them as individual cases. The opposite to that was that they really did appreciate when social care staff and social workers gave time, thought things through carefully, focused on the individual and considered their individual needs. So nothing too surprising there, really, in a way. What we did also identify was some very high levels of satisfaction. And it's interesting what you said earlier about it depends on what people's perceptions are and what they're preconceived to understand. So in some respects, some people, and we haven't got the quote here, were saying that the services were very comprehensive, but their expectations actually were very low, and it may be that that had some resonance with their feelings. One of the things that we asked specifically about was about personal budgets. And here, I suppose, we could say there's a not-so-good news story and a very good news story. Again, this was probably down to lack of awareness. People didn't know that such a thing existed. They didn't know how to access personal budgets. And even those people that were using personal budgets didn't really have a full understanding of how they could be used. Now, that's clear in the literature as well, and it's clear that in fact some social workers and social care staff also don't understand that, so it's no surprise really. The people that were able to access the process found it very complicated, and you'll see from this quote here, this was somebody that actually abandoned their personal budgets because they found it so hard to navigate the process. And when people were using them, some of them were spending them on a very limited focus, and that was because that's what they understood them to be used for. That said, the good news story is that they actually can be liberating. And for those people who are struggling to access services that are culturally sensitive, being able to operate with a personal budget allows them to seek out the help that they need in the way that they need it. So I think that's something that we will highlight as information needs to be given. The wider concept of personalisation and co-production were really not present in the data, but I guess that's a limitation from our perspective that we didn't particularly ask about that either. In terms of language sensitivity, again, some similar findings. It was a particular barrier to negotiating services. People were struggling. A lot of our participants were immigrants and with limited English language skills, and they found it really very difficult to access the service and then to negotiate the service once it was in place. And so we're doing things like using hand gestures with their care workers and hoping that each would understand each other. The issue of interpretation came up quite a bit. People, perhaps initially when a service was put in place, had some access to interpreters, but that soon waned, and people were expected to draw on their own personal contacts to act as interpreters. So we have people talking about their daughters, their friends, their bosses, and therefore we're discussing some quite sensitive and perhaps confidential information through a third party who may not respect that, and that was a real concern. And people who had experience of services dropping off from their friends as well as from the statutory services. And cultural sensitivity was clearly an issue, and I think we can't emphasise how important food was to the people from the Chinese backgrounds. we were questioned as to whether that was just the case for everybody, and it may be for minority ethnic groups, but the different needs are different for different groups. And so we had people talking about having sandwiches put in front of them with a cold drink, and they need hot food and hot drinks, and that lack of understanding was really causing people real discomfort. So they were talking really about needing to employ somebody from a Chinese background to understand that. A lot of people were just relying on personal resources because in some cases they found the other services were not there available for them. And there was a feeling, I think, of some people saying, we shouldn't ask for much. You know, in this times, we're here in this country, we're grateful, we shouldn't ask for too much. And that came out of a few quotes as well. So in terms of where that leaves us for practice, there is this universal view that people value services that are responsive and treat people with respect and like humans. And I think that's a universal view for whoever you may ask and whatever literature or cultural groups you go to. And I think that's pivotal. If that's addressed, then the other things can fall into place. The use of care workers from Chinese backgrounds is desired and appreciated by Chinese people. But there lies a problem because care work is not something that's seen as a career choice amongst people from Chinese backgrounds. So there is going to be that disharmony there. And so one recommendation is developing career opportunities for people from minority backgrounds and identifying that this is a good opportunity to work in these areas and will become more so in the future. It was very evident that personalisation, particularly in the form of personal budgets, can prove liberating for people from Chinese backgrounds. And the reasons that they were not accessing that was because of the lack of information. And so developing information that means that people understand the range of services that they can purchase and what they can use their budgets for really needs to be taken on board. And there needs to be moves to genuinely engage Chinese people in co-production. They are a culture, and understand that that's a bit of rhetoric as well. It is a culture that relies on their own resources, and so we should be harnessing and levering those resources. We recruited many of our participants through Chinese welfare organisations, and of course they do exist in the inner city areas in England. They do not exist everywhere, and for those people that we recruited, they pointed very carefully to some of the services that they've been able to access, such as identifying volunteers, giving information, giving it in a culturally sensitive way, helping with decision making, signposting other services, and providing specific services from those organisations. Now, there are only a limited number of these organisations, and so there needs to be consideration of how they can support in the areas that they exist, but also in terms of what other micro-services might be available in other areas. There's most definitely room for mainstream social care services and Chinese welfare organisations to work together, to look at things like joint training, to look at how they can share information, and specifically to look at issues around cultural awareness. I think that we can't emphasise how much they were of importance to the individuals that took part in our study. Our concern is that those people who are in very dispersed parts of the country with not a close network have not got these opportunities to draw on. We weren't able to access those people for our study, and so we don't know how important that is to other people. We suspect it's very important. So here's a good quote that we picked. Creativity and the taking of calculated risks needs to be supported, and I think that's the message that we'd like to take forward, really. A small investment in these services could have a significant benefit for the individuals who need social care services, where they are not able to access the mainstream services that other people may expect to have. And that will help to move along the personalisation agenda that we all, I think, now sign up to. So here's some references, and just to finish with the the disclaimer. Thank you for your time.
Okay, so we haven't got a lot of time, so I'd encourage you to make your questions concise to all three presenters, Rosalind, Michael and Fiona. Who's going to go first, or shall we have the other 2 minutes silent? You say who you are, and then that would be helpful.
Well, I'm Jo Moriarty from the Social Care Workforce Research Unit. Thank you all for your 3 really interesting presentations. The relational aspects came out really importantly, didn't they? And you mentioned, Fiona, the issue about workers, the importance of recruiting workers who had language skills, but the fact that perhaps there were fewer people within the community who were willing to work there. Do you think there is a message for 2 messages? One for sort of social care providers in terms of recruiting culturally diverse workforces, but other in terms of the opportunity for people from a white British background to learn languages, or which was something that I know they did in Wolverhampton for that project about people with dementia, learning how to say a few basic words. You know, like, is it actually about white British social care workers becoming better at learning other languages?
It's certainly better that they have more of a cultural awareness of the cultural roots that they support. And my experience from other work is that people always appreciate even a few words of their own language, and that demonstrates some sort of respect to the individual and an understanding that they've made the effort to demonstrate that. I think social care providers do need to go out and consider how they can recruit people to their services. But the difficulty also lies with the community themselves, in that unless it is an attractive option to them, that isn't something that they're prepared to take up. And so we have been talking to the Chinese welfare care organisation here in Birmingham about what they could do to make that a more attractive career option for the future. I don't think we've got the answer yet, but I hope we will do.
Three excellent presentations, sure.
Yeah, I'm Jill Green from the University of Essex. Thanks, I really enjoyed all 3 presentations. I was interested in what Michael was saying about the sort of fluidity of cultural sort of identity, and that it's quite difficult to categorise people just on the basis of where they're born or what their origin is, and actually put them into a box. But I was just wondering, Michael, you gave sort of very, very interesting how you dealt with that, and that became sort of one of the things you actually researched. With the other 2 projects, how did you deal with that? Because it's often really difficult to say, even some of that white Irish, which perhaps should be the simplest, it's actually quite difficult to actually say when is somebody a white Irish person.
Well, that's actually something we did want to look at in our study as well, and I couldn't present everything here today. So we've looked at things like people's migration histories, and we found that people who came from East Africa, as opposed to directly from the Indian subcontinent, tended to talk about things in a different way. And some of our participants who come from Kenya said, well, we've already been in a minority before. We know what it's like to be in a minority. So when we came to Britain, it wasn't a new experience for us. Whereas they were contrasting themselves with people who come directly from India or Pakistan or Bangladesh, where it was completely a new experience to them when they come to Britain. We also looked at our own cultural identity as researchers and how that was affected by the research and the way the participants interacted with us and the assumptions they made about us. Quite often they would assume I'm white British, for example, but both sets of my participants, the South Asian and the white British people, many of them assumed I was white British. There were a few who picked up on the accent, but not many. And with Priya, everybody wanted to know where she came from, where her family were from, where they lived. Her parents were from Kenya, so they wanted to know where they came from as well. So it was a really interesting issue in that sense.
I can't help thinking, if you're walking down the street, the presumption is that you're white before you're Irish.
Yeah, exactly.
We built on our studies, we found that participants with a better language skill in English, they what service is available, but they tend to have a lower satisfaction with the services. Whereas people who, Chinese people, they're not as proficient in English language skill. It's very difficult for them to access services, but once services have been put in place, it seems that they have a higher level of satisfaction with the social care services. And I think that maybe that's because something gets they have some unformed experience, and hence they have lower expectation of services.
Am I right in thinking, though, that you were indicating that co-production, in other words, when you talk about services being put in place, I assume you mean that these services are designed with the community as opposed to put in place? Because it's clear from your research that if we carry on doing what we've always done, getting what we've always got.
You didn't find any evidence of people being involved in co-production, apart from honestly what we've seen in the literature, in terms of identifying personal budgets, but the actual sitting down and producing together a plan of how care might be put into place.
I think in relation to the identity thing, I think for me the interesting thing is that we tend to use discourses like, oh, it's the Chinese community, but actually when you start actually sort of really looking into these things, actually there's no such thing as just one community from Chinese people. They're from a variety of cultures, a variety of communities. So as we said here, there are many people who are Cantonese speakers, many people who are Mandarin speakers, Hakka speakers. China is made up of 57 minority cultural groups in itself, which are recognised by the People's Republic. But we know there are others. So there's a massive cultural diversity even within this one bracket group. And I think that had an interesting impact. And in relation to disability, if you like, what disability actually meant to different people. We had quite an interesting sort of time trying to just describe exactly what we meant by disability or physical impairment or social services. So that meant that a lot of our sort of interviews were talking about sort of exactly what we meant as well as what the people had to say about it.
So it does challenge the notion of what is a service then to this community that we call Chinese. I mean, it's very difficult if you said we use the term Chinese to talk about all 50, a bit like the term black.
In the main, the people that were receiving services, there were 2 or 3 that were in residential care. The majority were receiving some sort of home care service. Is that fair?
Yes.
Yes.
So those were, but our definition was receiving any service that could be a requirement for a physical disability. So we did really struggle with the
Please.
In the studies, a lot
Who are
of...
you first?
Oh, sorry. I'm Jenny Wilding from Research Plus, an independent research agency. In the studies, you identified a lot about cultural difference and language difference and things like that. Did any of the participants actually report on feeling that they were discriminated against, or that there was racist behaviour by the staff that they saw, or even that the way that the whole system is organised is a discriminatory sort of system?
Is this a question to all 3 researchers?
Yes.
Okay. Who's going to go first then?
In the previous work that we've done with families, some families certainly felt that the system was unfair and discriminated against them, but in quite complex ways. So, for example, some participants in the family study would say, so these were all different South Asian populations. So some of them would say that they experienced racism, and others would say that they would rather see a social care worker who was white, because that would protect them from stigma within their own community. So there were quite complex decisions being made within those groups, but that was families and carers. In our follow-up study, the one that I reported on today, there were no stories of discrimination really that were reported. But again, I think that's partly about buffering. there was an awareness that racism was out there. So one story that comes to mind was one of our participants highly emotive about an incident that occurred at college when he'd seen somebody else being subject to racist abuse and had realised that he also could be positioned in that way, felt very uncomfortable with it. So there was, there were stories like that, but nobody had experienced the social care system in that way. But I think that's partly because they are, our participants were in a sense protected from having to do the accessing part of the process. Their families on the whole do the accessing part of the process.
We had a few examples of people reporting that they've been treated unfairly. And some of these, they said, yes, it's because of racism. So we had one participant in particular who said, I asked for this particular service, they didn't give it to me. My neighbour has got it, she's white British. That's the only reason they wouldn't give it to me. So she was South Asian, she was saying it's because the other person was white British, that's why they got it. So she directly said it was because of racism. Several of our other participants, including the white British, said, I'm not getting this service, I don't understand why somebody else is getting it. I know they're getting it, why can't I have it? But they didn't say it was to do with racism, they just said, I don't understand. And so the white British people just didn't come into their discourse that it could be something to do with their ethnicity, but it was present in some of the South Asian interviews. Most of the experiences of racism we did hear about, they're actually talking about hospital care and health services as opposed to social services. And we also had some descriptions of racist abuse from neighbours who lived near a culturally specific service who would swear and shout at people going into the day centre, particularly around the smell of the food that's being cooked. They seem to object to, and that service closed down. Not necessarily because of that, but that was the experience that people told me about it.
It's interesting. There are two levels of racism, though, because what you're describing is very personal and direct, but in a sense, all three presentations, if you step back, you could argue the whole system is racist, because I think you started your presentation, or somebody did, by referring to the assumption that different races look after themselves, which is itself a racist assumption. So there's something about the view that you take. You could argue if you've got the fastest growing population being Chinese and it's getting the service that you described, that is in itself racist. It's institutionally racist. Which is interesting. Are there any more questions, comments, observations, fascinating points of interest? Stunning insights.
You're raising the bar higher.
Just make an observation. Several of you talked about people's expectations, and I'm sorry, my name is Holly. I work for the Challenging Behaviour Foundation, supporting family carers of people with severe learning disabilities. And our experience is that people often have too low expectations, and we try and encourage people to ask for more, because they have a right to more. And do you think that's an issue that people do need to be encouraged to think bigger?
Certainly in terms of people accessing services, as I said, we had more than one, or we had several incidences of people reaching the crisis point before they asked, because then the services were put into place. So if they had asked earlier or had higher expectations, it may have prevented that crisis from reaching that point. So absolutely.
It's rather convenient that people don't ask, isn't it?
Of course.
For the system. I was thinking about the similarities between the three of your pieces of work, and the one thing that connected them was actually demand management. It kind of works, doesn't it? I wonder whether anybody did any, or was planning to do any work on the impact of.
It's very interesting from one of our focus group meeting discussions. When some of the participants they joined together and had a discussion, they actually felt that at the end of the meeting they exchanged contact data because they felt that it's very important. There was a form of forum so that they could exchange information And I think it's also, you know, I've done a lecture, so it's a couple of on my own, open to all people. And so the Chinese people from Chinese background, if they want to access information, sharing experience, how to access services.
If all three communities made the appropriate demands that they actually don't have a right to the challenge to the system, but they not. Whether consciously or unconsciously, it's convenient that they don't make the demands, which I just wonder whether this is. I also wonder about failure demand, actually, because if people are using services in crisis, then that's going to cost more than the issues. And I wonder whether that was worth thinking about.
My name is Polly. I'm a service manager from Older Person Service, City Council. Especially the third, your study on Chinese minority group. I found that it could be taken as a very good case study of good practice in terms of which we said about looking at what's happening now, how we can manage services more at a preventative level, where you focus more on services which can be given to minority groups. It's not just Chinese. There's a whole lot of minority groups that are migrating to Britain, especially even from the European Union. So this is a very good case study where you can focus on how services can be provided at a preventative level rather than dealing with crisis situations. And that could be replicated in all different minority groups. And I think that would be really very much linked with what we heard from the Minister today as well, in terms of the better care funding, where we need to focus more. So I found that was very interesting. And for me, looking from a statutory perspective, I found that was really a very good.
I mean, all three presentations have preventative elements in them.
And also one thing which I found, for all the three studies, I was just thinking, because your studies still focused on social care services, one of the main stakeholders was obviously the commissioning comes from social services, and there should have been some views about social workers, which was missing in terms of what was their perspective, what was their views, and that would have, so I thought maybe that link would have.
We do have that in our study. We have interviews with social workers and care provider managers and support workers. So there is that as a counterpoint. I just didn't cover it today. But I mean, one thing that fits with the point that you're making that's from that data is that what people will often say from a staff point of view is slightly contradictory. So on the one hand, they'll recognise the complexity of any individual family's cultural positioning. So they will tell you about cases where their stereotypical assumptions about what families' needs might have been were overturned when they got to know people. And then almost in the same breath, they will tell you that they can't work with population X or Y or Z because they haven't had cultural competence training for that population yet. And the more diversity you have, the less realistic it is to think that you have to train everybody to work individually with every niche population. What you need are flexible services which can think on their feet, formulate and respond. So I think that's the challenge.
In our study, we did a similar thing. So we have 39 interviews with people who work for social services, commissioners, domiciliary carers, and so on. I didn't have time to present that today, sadly, but that's coming next.
I'm struck by the nature of, I think it was, Rosalind, you were saying that you were very conscious of the culture of the people doing the interviews. And I couldn't help thinking, I wonder whether there's something about the culture of people doing research or lack of it. Because academia is pretty, as a general statement, it's pretty wide, isn't it? I just noticed, not in this room, but generally in my journeys, I wonder whether that drives the attention of resource allocation, research, leadership itself. Well, that struck you, don't it? Any other views? Good, I'm going to go.
Sorry, I'm going again. I did some work last year talking to some people who work for local age UKs. This is just really more of a comment leading on from that point you said about culturally sensitive workers. They were mainly outreach workers from various black and minority ethnic groups who were working with local communities. And I asked one person in particular about this issue about, you know, well, perhaps in a few years' time we won't need culturally specific services. And she made what I think was a really, really important point, which she said migration is a dynamic thing. And so she said that a lot of this idea of commissioning, of we no longer need to commission for culturally specific services, they may need to be different groups, but actually they will still be there. And I thought that was, you know, a point really worth making.
Yeah.
That she'd said.
Yeah.
Following on from that, so I was just going to ask, with the talking tools that were developed, could they be used presumably by anybody with learning disabilities?
Yeah.
So they're not, they aren't a sort of little sort of cultural sort of identity issues.
No, we've tried to make them so that if you do the cultural one first, that foregrounds cultural identity, but it could be any cultural identity, and then the other ones follow from it. But they should work with any population. They're quite challenging issues.
Okay. Well, if people have run out of questions and observations, we can draw this to a close. I was struck by the, I mean, thanks for the presentations. I actually will be sharing these with colleagues back at the farm, Turning Point that is, because I think they are really quite insightful and practical in their work. I guess what strikes me is how, I mean, I don't know whether you all know each other, you know, you'll chill out with each other, it seems to me that, I'm blinding. It is obvious, isn't it? It feels obvious that the prerequisite to any relationship might be language and knowledge. The lack of language or the knowledge of each other, as well as the systems in which you operate in, seems to be quite key to this challenge. I'm left with lots of questions about the nature of the challenge. I mean, I look at this room, I wonder to what extent, for instance, if you say that the Chinese are the fastest growing population, what is the demographic? Because, you know, is it a challenge to the whole system, or just the systems in London and Manchester? You know, and I suspect it is a challenge to the whole system. And the same can be said. So I often wonder about these debates. To what extent do they look out and address the whole system, and to what extent do they don't they? I mean, I doubt if Norman Lamb talked about this in his speech earlier. It would be great if he did. But at some point, this becomes a mainstream issue. You see what I'm saying? And it always feels like it isn't. And I think there's some work to be done to make the case, the public policy and economic case for this. Otherwise, it will cease to be. It will remain in the interests of interested academics as opposed to the mainstream. But interesting step. We need to tell people more about this. So you can fill the lecture room next time. Or they could have just been the chair. Thank you very much. Have a decent lunch.